Most obvious here is because it is iodine. What's going to happen is, even when we inject the veins, you're going to get a funny metallic taste in your mouth as if you were sucking on pennies. Okay? Because iodine is a metal. You guys know that, right? Iodine is a type of metal. And so when we do a bolus injection of that, a rapid injection of the contrast media, they're going to get a funny taste in their mouth. Now remember this first part here for a minute. In the cardiac cath lab, again, I'm bringing my experiences in here. A few years ago, we were doing a procedure on a 90-year-old female, very ornery, okay, very sassy, okay, and she was just a hoot. She was very fun to be with. So, in addition to the cardiac injections of contrast into the vessels, what we'll also do is we'll put a catheter inside the left ventricle, because now we're going to fill up the ventricle with contrast. I'm talking about a whole lot of contrast, so we can see the ventricle inflate and deflate. Okay, expand, okay, and contract. Expand and contract. So we usually inject about 50 cc's in less than 1 second into the ventricle. Okay, the moment that the contrast enters the ventricle, it gets pumped out to the body immediately, right? Because that's what your heart does. Okay, but we can see the outline of the ventricle. Naturally, what's going to happen is your body's going to feel warm throughout, and you may also get a warm feeling around your bladder, because it goes quickly into your kidneys and it goes into your bladder pretty fast. Okay. So prior to the injection, I was the X-ray tech that day, so I was operating all the X-ray equipment, including the automatic power injector that's going to send this bolus into the catheter and into their heart. I said, Miss Jones, this is what's going to happen. In a moment here, we're going to take a picture of your heart. Okay? You're going to feel a warm feeling throughout your body that's going to go away in just a few minutes, okay? All right? So I'm stepping away, and I'm saying, okay, Miss Jones, you're ready, right? You ready? Okay? I want you to just hold your breath for me, okay? Just hold your breath. And so I'm setting up the X-ray equipment. I'm also, on my other hand here, I'm setting the power injector, and her body just gets filled with contrast in her left ventricle. All right? It went from dead silence to, woo! That wasn't me, that was Miss Jones. Miss Jones, are you okay? Are you okay? She said, honey, I haven't felt like that since I was a teenager. She felt the warmth right here in her pelvic area. So she said, I haven't felt like that since I was a teenager. I'm like, oh, okay. I said, by the way, my name's Tony. So yeah, she had that feeling throughout her pelvic area. All right. So stop or slow down the rate of contrast injection. Okay. So if they start feeling any of the mild, especially with mild, you're either going to stop or you're just going to slow the infusion rate, and also just kind of keep a close watch on them. Okay. You'll observe the patient closely and reassure the patient that everything's going to be okay. We talked about the mild adverse reaction. There's going to be some complaints of itching of nose or eyes, anxiety, possible cough, and also hives or rash or urticaria. We already went through this, right? So again, stop what you're doing, get help, be ready to assist, take vitals every 5 minutes, so on and so forth, okay? Because now what can happen is, keep a close watch, because now we can go from mild to moderate to severe, which is now going to may lead to anaphylactic shock. Okay, here's your intermediate or moderate reaction. Coughing that results from laryngospasm and angioedema of the upper respiratory tract, leading to a feeling of tickling in the throat. Dyspnea, difficulty breathing, and wheezing resulting from edema. The initial symptoms of shock includes anxiety, rapid pulse, rapid respiration, hypotension, and complaints of chest pains. Right? Heart fast rate.
It's all kind of universal on like it.
Huh?
It's all kind of universal.
It's all universal, yes. So again, shock is shock is shock is shock. It depends on where it originated from. Okay? Again, stop what you're doing. Get help. You're ready to assist. Vitals every 5 minutes. Reassure the patient. You're ready to perform life-sustaining measures. Okay? Remember setting them up? When you sit them up, it helps them breathe better. and then your major. Any mild reaction can become a major reaction within 2 to 3 minutes. Never ignore the early signs of anaphylactic shock. When performing these procedures, you always got to be on your toes. Never, ever, ever, ever let your guard down, because the moment that you do, it's going to be that patient who has an anaphylactic shock in your presence. And then what are you going to do?
Stop what you're doing.
Yeah, stop what you're doing.
Is iodine contrast used in like all modalities of X-ray?
It's used mostly in the radiology department. They use, I'm talking about
I'm saying like just
X-ray.
basic X-rays. They use iodine.
Iodine. They use iodine for the venous system, the vein in our arterial system, so the circulatory system. For the bowels, we use barium. And then if you go to MRI, it's a whole different contrast. If you go to nuclear medicine, it's a whole different contrast. But iodine is the prevalent contrast that we use in radiology. Okay. All right. So, major reaction, patient can go into shock, seizures, and then full cardiac arrest. All right. You guys know how to call your code, right? You should have been oriented on how to call a code on your first day when you're doing your clinical externship. They won't put you out on the floor in the department until you've had an orientation. Okay? So one of those that you will learn how to do is how to activate the code blue. What's a code blue?
Cardiac arrest.
Okay, full cardiac and full respiratory arrest. You're either going to dial a set of numbers. You're either going to call your department. You're going to yell down the hallway. You're going to push a button. Know the procedure in your hospital and your department how to activate a code blue. And then you're going to be ready to perform CPR or shock the patient. Okay? So as part of our assessment, when taking our patient's history, all these can influence the possibility of our patient having an allergic reaction. You're going to ask the age of the patient. History of impaired hepatic function, history of impaired renal function, anything that has to do with the livers or kidneys. This is not related to an allergic reaction. This is actually related to, remember, the contrast is thick and viscous. Okay? So if we don't get an allergic reaction, we can actually cause other problems with the body. One of those problems is because the contrast is thick and viscous. What happens when the blood that is thick and viscous goes into the kidneys?
To work that much.
You got to work even harder, okay, to filter out the blood. So now you can overwork your kidneys. One of the assessments that we do is we check for liver and kidney function to make sure that the patient is within normal limits. How do we know that? What are we looking at? The patient's not going to be able to tell me. I'm going to be looking at their chart to see how their kidney function is, how their liver function is. Okay? So anything that has to do with the kidneys, okay, the thyroid, okay, possibility of pregnancy. This relates with X-rays, because we're performing X-rays. We got to make sure they're not pregnant, right? Lactation. If it's post-mortem, mama's breastfeeding the child, is that an importance to us?
Yes.
Yes, because where does the contrast go? It may also go into the mother's milk. And now the baby is drinking some of that iodine. Okay? All right. We'll leave the rest of this alone. It gets a little bit too deep. Okay, but we're going to leave the rest of this alone. Okay? So any type of blood disorders, this also can cause complication because remember your red blood cells are going to be carrying what?
Oxygen.
It carries oxygen. So when you have contrast mixing with the blood, you're preventing oxygen to attach themselves to the blood temporarily. So if you have any type of blood disorders, it can cause complications with our patient's health. This is what this means. Okay? All right. Infants, children, and elderly are more susceptible to different types of contrast that we use. If they are dehydrated, if they have a history of dehydration, we may not want to use iodine because iodine is like a diuretic. It's like beer, it's like wine. It pulls fluids from your other cells and it causes you to pee. Notice that when you're drunk, you're constantly peeing and then you also become dehydrated, right? What is the result of you constantly peeing and you're dehydrated? What happens when you wake up in the morning?
Get a hangover.
You get a hangover. That's what a hangover is. Lack of fluids. Okay? So if the patient is dehydrated, we're not going to give them iodine because it can make them even more dehydrated. Highly viscous contrast should be injected not into the carotids or the vertebral arteries. Extravasation and infiltration of iodinated contrast may cause extensive tissue damage and must also be prevented. So when you are injecting the contrast, not only are we observing to make sure that there is no response to the contrast, but we also got to make sure that the contrast isn't leaking in the tissue. Okay, you guys ever have a blood drawn and you get a hematoma? Okay, that's basically poor practice of injection because now that's blood leaking into the surrounding tissue. Well, that can also happen when you're injecting contrast in the patient's vessels. Some of it is going into the vein, but some of it's also leaking into the surrounding tissues. This is known as extravasation. Okay? So when the contrast agent leaks into the surrounding tissue, you can have what's known as extravasation, and the contrast media can also cause damage to the surrounding tissue of that injection site. Okay? All right, and then lastly, overdose of iodine may occur between 80 to 90 grams. That's a lot. Okay? 80 to 90 grams of iodine may produce symptoms of tremors, irritability, and tachycardia. And you want to stop injection and call for help. This never ever reaches that point. Okay, when we're talking about grams, we're talking about the amount of contrast that we use in any department is usually like 0.005 to 0.05. Okay. All contrast should be administered at the body temperature. So the contrast that we use, we keep it in a warmer. It goes in a lot better, a lot nicer, because remember it's thick and viscous. If you're injecting something thick and viscous into your vein, you're going to feel that. It's going to hurt. Okay? If we can keep it to the body temperature, it goes in a lot easier and it causes less pain on the site of injection. Okay? So we keep our vials of contrast in what's known as a warmer. It keeps it warm at body temperature. All solutions administered should be clear. So when I hold up my vial of contrast before I inject it on the patient, I'm going to do an assessment of my contrast. I'm going to look at it under light to make sure there isn't anything floating around. That makes sense, right? It's got to be clear. You don't want anything floating around and injecting that into the patient's body. Okay? We're going to keep it in the dark. We don't leave our contrast agent out in the light. Because when you leave it out in the light, it loses its efficacy. It's not as effective. So we keep it away from light. So it makes sense when you put in the warmer, it's going to keep it warm and it's in a dark environment. Right? Discard all unused contrast that has been opened. Everything that we use in our department is for single use. So if you use it, I am not going to save it for the next patient. Get rid of it. Single use only. And do not mix contrast with other drugs. If you have an IV line, okay, so a patient comes down from the floor with an IV line, instead of me starting a new IV for contrast injection, I can use that same line that already exists. So I'll just inject through that IV line. But you have to make sure that it is compatible. Because certain things, if you mix two drugs together, there might be a reaction to that. The patient may have a reaction to that mixed drug. Do not mix contrast with other contrasts. Okay. Do we have any questions? All right, guys. Are we done here?
Are we?
I don't know. That's a lot of... I can't talk. I need to have a Snickers. All right, guys. So next week we will... Next week we will we will close the presentation. So we'll finish our Unit 3 next week.
Oh man.
Okay?